This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch. Every Sunday, 8 till 9 here on Talk Radio 1210. WPHT. It's a beautiful day in the neighborhood. The Phillies won. I stayed up, and I'm feeling it.
As your health care provider, I'm going to reprimand you for that. He's supposed to be resting, folks. Well, but I understand.
Yeah, it was a compelling game, and I had to stay up till the end.
Gotcha.
And what can I tell you? But it's a good win.
God bless.
And we move on to play the Braves. But anyway, we're in a good mood here on the show. Health Watch every Sunday, 8 till 9, with Dr. Molly Fantasia, the PhD doctor and the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We discuss on this show the who, what, when, where, why, and how of Innovative Medical Associates and how it can potentially help you and your family improve your overall quality of life. And today is no exception. We'll do that. And we welcome your calls at 855-839-1210, 855-839-1210. And we always like to start with, well, Dr. Molly, how is innovative medicine different from the rest?
Okay, that's simple, John. You know, we are a primary care group of healthcare providers who are like-minded, so we're a cooperative. Everyone works out of my facility in Marlton, and what we have is we can do anything your GP doc could do. If you need a prescription, it can be written. If you need some radiology, we can send you out for x-rays or whatever. If you need some laboratory tests, we have the ability to draw the lab tests right in our facility and send them out and then get them to review with the docs. But what separates us from everybody else is we want to use the least amount of pharmaceuticals necessary to actually help a patient effectuate the medical change that the doctor is looking for and minimize the side effects from all of these drugs. And how do we do it? It's simple. We use hydration as a vehicle to deliver natural substances, vitamins, minerals, amino acids, things you'd find in the health food store. Easy. And what we like to do is we like to give our patients the option of utilizing these types of substances to effectuate the change, minimize the side effects, thereby improving their quality of life.
I'll tell you what else I like about your facility, and I can attest to this. You spend time with patients.
I try.
I mean, every patient you spend time with, and, you know, people aren't used to that.
Right.
And that's, we've become so accustomed to in, out. You wait for a half hour for the doctor or an hour.
Right.
He comes in, 2 minutes, boom, next patient.
Well,
but
yeah.
This situation is clearly different. So I want you to talk about
Sure, that's easy. One of the things, obviously, if we're using hydration as a vehicle and patients are in certain protocols, which, by the way, are individual to each individual patient according to what we're trying to help them with, they're sitting in the chairs. And I make it a point to go out on that floor maybe every half hour or so, just to say hello, find out how they're doing from the last visit.
Yes.
But then I can set up a specialized conversation with a patient. You know, I take them into our conference room and start to talk. Let's get the dialogue. Let's see where we're going with your treatment protocol, how you're feeling, and do you see the improvement? And again, I'm going to tell people, look, this isn't holy water. But I'll tell you, I have seen miracles, and this past week I've seen more, including you, thank God. Okay, so with the good Lord's help, I know that this is a viable option for people to look at to utilize God's ingredients in a way to help you. But I'm not telling you to throw away your medication. I'm not telling you to get rid of your primary care doctor or your specialist. But I am telling you to open up your mind, look at some of the alternatives out there. And I also am telling you that the types of protocols that we use in our facility are very well entrenched in science. And that, I would say, separates us from a lot of places that are hanging bags right now, delivering IVs and saying, come on in for your drunk tank and, all of these spa-like things. And we really are a medical facility that concentrates on particular patient problems and tries to effectuate the change for the patient.
You're not a spa. And then you've said that many times.
No.
So
we want you to relax like a spa.
But your really primary focus is the medical.
Right, exactly, John. We want to effectuate change. So if you have high cholesterol, we want to help you get that down without possibly using a statin. If you have hypertension, we might want to augment your hypertension medication with some natural substances and not just garlic, which everybody knows about now, that can help you reduce the amount of blood pressure meds, thereby reducing some of the side effects, which, by the way, for most of my guys, it's always the ED issue, right?
Yes.
So this is the thing. We look at the patient's overall quality of life, and that's our focus, maintaining the patient's progress through a particular condition and helping their quality of life.
What's the main ingredient that you use?
Where do you want me?
And I know the answer, but go ahead.
You think, everybody's going to know I love vitamin C, but again, the question is, what type of vitamin C are we using? It's going to depend on what we're trying to effectuate. For our cancer patients, I like to use a lot of tapioca. Sometimes I use cassava. Very rarely do I use a beet vitamin C because it has too much sugar. But here we go again. Vitamin C is probably one of the top antioxidants out there, but it also has the ability to become a pro-oxidant, which means it's very useful in terms of our cancer supportive care.
When a patient signs up for your protocols, what can they expect? Can they expect 10 treatments, 5 treatments, 20 treatments?
Right. I think realistically, the way we're set up is we know a minimum of 10 treatments is going to be what is necessary at least. But in many cases, if you come to me with a 20-year-old problem, believe me, we're not going to solve it in one dip in the water. It just doesn't work like that. Somebody said to me, someone called me last week and said, where are you getting your fluids? Is that from the Magic Spring water or something? Apparently, there's somebody out there selling type of holy spring water, which, God bless them, I believe that.
I've seen the commercial.
Oh, have you?
Yeah.
I never saw it. And I thought, that's a wonderful thing, but that's not what you get in my clinic.
No, not at all, and I can attest to that.
Yeah, I just want to say that. And so, again, it's not holy water. It takes some time, John.
And after the 10, 12, whatever it is, then what?
Well, then we're going to look at where you are. We probably are going to do some blood work. I'm certainly going to ask you certain questions about your quality of life issues. How's your stamina? I just asked you this morning.
Yeah.
Hey, how you feeling? You're a little tired. You look a little tired to me today.
Well, blame the Phillies.
I am going to blame the Phillies. And I didn't yell at you, but I said, listen, John, I understood because I was up all night too. But, here's the thing. I want to know qualitatively, how are you doing? Because in many cases, you start to feel the qualitative improvement, which means things like I'm less fatigued, I have more energy, I can sleep better, all of these kinds of things that we take for granted before we actually start to see changes in the blood work or in the radiology and that kind of thing.
Yeah, well, I am sleeping better.
Good.
That's
Good.
A given. But I feel improvement.
Thank God.
Every day I feel improvement.
Well, you look great, and you're certainly holding your own, and that's what we love. We're
coming up on our first break of the morning. It is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. 855-839-1210 is our number here in the studio. And we always tell you, call early because, you call it 2 minutes to 9, we got to go up the air, so we can't take your call. We want to take your call, and so please call early, 855-839-1210. It is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. More with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. And I'm John DeMasi. We'll come back after these words. Welcome back to Health Watch. Operators standing by right now at Innovative Medical Associates, 856-489-0505. That is the number. And remember, the initial consultation with Dr. Molly is complimentary, so it doesn't cost you anything. And the consultation, as I said, is complimentary. 856-489-0505 is the number. 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. It is Health Watch, Sundays 8 till 9 here on Talk Radio 1210, WPHT. 855-839-1210 is the number here in the studio, 855-839-1210. And Dr. Molly, you've always talked about inflammation.
Right.
You talked about bad inflammation, good inflammation.
Yeah.
So you want
Angel and devil.
Right, you want to separate that for us and talk about everything there is to know about inflammation.
Well, I don't know if I can get everything there is to know about inflammation because there are scientists and physicians who are still working on this. But one of the things I can talk about is the acute versus the chronic inflammation. And when people generally come into my facility, what's happening is they have the chronic inflammation. But what's interesting is many times it starts with an acute inflammation. And gosh, we need that acute inflammation. For example, if we have a burn, if we have a laceration, if we have trauma injury, those kinds of things, we need the inflammation to help your body heal. That's what the God-given thing is. It will heal. It will help our white cells go where they're supposed to go. It will start that cascading. However, it can also start with an allergic reaction. This is why I'm talking about it today. And, you know, I hear more and more folks who talk about their allergic reaction to things like vaccines. I hear that all the time, particularly things that are out right now because there's a big push not just for the COVID vaccine, which we all know about, or the boosters, but also for the flu vaccine. And it's interesting because they actually have a vaccine now, particularly for seniors, of which, you know, I have several seniors in my facility. So if you have an acute reaction to or an allergic reaction to some of that or some ingredient in the vaccine, do you think you have a chance possibly of having chronic fatigue?
Yes.
And fibromyalgia and all these other issues because you're ending up with something called chronic inflammation? The answer is exactly right, John. It is yes. And we've seen it. And it's one of the things that my docs and I talk about on an ongoing basis. So something that's good can go into overdrive, causing all kinds of problems. And this is cardiovascular problems like stroke, okay, neurological disease, autoimmune diseases, rheumatoid, cancer, all things like lupus, MS, these kinds of things, fibromyalgia, like I said earlier, and chronic fatigue. So the idea is you want an acute phase inflammation to be controlled. And how do you think we do that at our facility?
Hydration.
Right. We do it with things like vitamin C and other nutraceuticals that we know have a particular effect on the cytokines, the interleukins, the cascading that is so complex in our immune system. So you've heard me constantly talk about keeping your own immune system in tip-top shape. One of the ways you do that is the use of natural products.
And does this work? That's really my question.
Oh, yes. It works. It works. Certainly, I can tell you that I have had many cases where people have come in with rheumatoid, and we're able to control the pain that these folks have by utilizing certain types of proteins that are naturally occurring, like amino acids. And again, the delivery system is the hydration. Why? Interesting, because we can deliver a therapeutic level and build up the patient's reserve and help what? Put out the fire. put out the fire and bring you back to homeostasis. You've heard me speak, probably too much so. I believe in the Goldilocks theory. Not too much, not too little, but just right.
How do you control inflammation? Is there a way to do that?
Got to keep your own autoimmune system in tip-top shape. God has put in an innate type of thing that allows the body to heal if you have a trauma. For example, interesting thing, I actually bumped my leg, and I ended up having a swelling in the leg, right? And I'm looking at this, and I went and had, because it was staying. And then I realized I haven't been following, I'm like the shoemaker with no shoes. So here I am, I'm not taking my own advice and giving myself the nutraceuticals, in terms of the IV nutraceuticals that I need. Well, guess what? What happened is this particular trauma started a cascading effect, and I couldn't get the swelling to go down. Well, Dr. Pat was kind enough to help me with that, and we delivered some regenerative medicine to the area, and I followed my own protocol, and guess what? It's gone.
Yeah.
So it's gone. I have no more pain. Everything is under control. The same is true for our patients. And in particular, John, I like to talk about this in particular for the cancer patients and the neurodegenerative patients and people with autoimmune disorders.
Is inflammation the root of many problems?
It certainly is. It is the root of most problems. In fact, it actually is also, I'm seeing some ocular problems, eye problems. We all know that there's been tremendous advances with macular degeneration. Tremendous. 26 years ago when we started, there wasn't any, but there are now. But really, when you look at this, it really has to do with inflammation in the retinas, inflammation in the macula. And how is that happening? In small particles. It means you have reduced blood flow many times. You might have higher pressure behind the eye. These are the things, and there are nutraceuticals that can help maintain your eye health, and it holds down inflammation.
This tells me that inflation is inflammation is everywhere.
Inflation is everywhere,
yeah, inflation,
too.
That's true. But inflammation is everywhere.
Right. You bet. And one of the things, as I said, you can move from an acute situation, which should be short-term, to a long-term problem. And that's what I'm talking about in terms of chronic inflammation. And one of the things that I do in our cancer support is we look at the potential cause for this particular problem. That's why it's so important. You know, someone said to me just this past week, gee, Dr. Molly, you have an extensive paperwork that has to be filled out for your cancer support program. And for someone who's always on the radio saying you can't cure cancer, you're sure asking a whole lot of questions. And I thought that was interesting. Yeah. And actually, she's right. Because why? I need to see some of the potential causes for the initial inflammation that might have gone haywire, and what's going on with your particular immune system, and how do I go after it?
So this whole thing about inflammation, how do you know what's acute, what's chronic? Does the doctor tell you, or do you know?
You'll know, because short term, again, something like a trauma, something like burns, it should only last until the healing process is going on. But if you start to have generic pain cleared down, let's say, the body, you start to feel it in your knees, you feel it in your spine, you feel it wherever, and you're also feeling less than optimal in terms of your thinking. These kinds of things. Alzheimer is an inflammation problem. We've talked about it. They talk about this in conventional medicine. It's plaquing. What is that? It's a protein that's been built up. I'm saying that in every single case that we look through, whether it's neurodegenerative or cancer related or these kinds of issues, when you really look at it, it's always related to an inflammatory process. It's related to things like plaquing. Stroke is another one. When you think about it, what happens? One area of your system biochemically goes out of whack. It starts some inflammation, and next thing you know, you have a blood clot.
And Hence a stroke.
Stroke, yeah. So these are the things. That's why it's so important to maintain optimal health. I'm not talking about just going into your primary and getting your yearly checkup. That's not optimal health. Optimal health is every day looking at what's going on for you. I'm saying biochemically, on a molecular level, what's going on in that wonderful thing God gave us, this body, and how do we maintain it in the most optimal way? And best way to do it is hydration.
Well, you're saying it's not just enough to just go once a year to the doctor.
No. You want to look at all your analytes. It's the kind of thing, I had a wonderful classmate of mine who comes in, and he was our class president in high school. Great guy, Ernie. Ernie said to me, Molly, I've been going to my primary and he hasn't run anything. I said, Ernie, I'm going to run an entire cardiac panel. I said, come in fasting. I said, you're a busy guy. Come in fasting. We need to see where you are. I said, it's not enough. I said, but I'm going to tell you, you're in much better shape than when you came to me 10 years ago. And he said, I know it, Molly.
Oh yeah.
I know.
Yeah.
I know it.
I know the patient, yeah.
I know. He's
come a long way, yes.
And he's also pretty sharp guy. So here we go. He goes to see his primary. His primary doesn't think he needs to run any blood work. He looks good. He's not overweight. Not enough.
No, it's not enough. It's the halfway point of the show, which means we still have plenty of time left to take your calls at 855-839-1210. The show is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. Again, 855-839-1210 is the number here. 855-839-1210. It's Health Watch. Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. More with her, and I'm your host, John DeMasi. We're coming back after these words. And we are back here on Health Watch. Operators standing by right now at Innovative Medical Associates. 856-489-0505 is the number. 856-489-0505. Call that number and set up your initial consultation with Dr. Molly. And I'll tell you what, you learn a lot in that initial consultation. So feel free to do that and set that up with Dr. Molly at your earliest convenience. And the website is innovativemedicalassociates.com. innovativemedicalassociates.com. A lot of good information on that as well. Check it out, innovativemedicalassociates.com. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. 855-839-1210 is our number here. 855-839-1210. We do have some open lines, so feel free to call in if you like. Dr. Molly, I thought we'd go over some patients.
Sure.
Because there's so many diverse stories.
There are.
And
there are.
This particular patient suffered from iron deficiency, but she didn't know about it.
Right. This is a very interesting case because this is a woman who has severe arthritic condition. I mean, she has rheumatoid arthritis where it has really impeded the quality of her life. One of the things, so she was complaining of an inordinate amount of fatigue. I mean, more than usual. Now, I want you to know she goes to a boatload of other physicians besides my guys, okay? A boatload. But she herself says she gets the most relief many times from coming into our office. So we were talking and I said, we really need to run an additional CBC. Now, part of the problem with laboratory testing, as you know, John, is unfortunately our insurers don't like to pay for everything. And I'm very acutely aware of that. So that I don't like to overrun, blood work. And I don't like us to go to these very expensive labs. If it can be done by LabCorp request, I like to do it. This is a simple thing. I ran a CBC. And what I found was she had a low hemoglobin, which means her red blood cells were low. And the hemoglobin is what carries oxygen to all the vital organs. They carry, that's piggybacked on your red blood cells. Well, hers was very low. Now, does she have a bleed? Does she have this? So, of course, we ask all the questions. The doctor says to me, Molly, we have to check. I said, I know, let's do it. So we asked the questions. We sent out for an occult blood, which means hidden blood in stool, these kinds of things. Nothing. Anyway, make a long story short, I reran again, an iron level on her, and it was extremely low. Don't know why. It could be one of the medications she was taking for the rheumatoid. Anyway, to make a long story short, we gave her a hydration IV of a particular type of iron, a more natural type of iron, and it's 4 weeks afterwards. Her hemoglobin now is well within the normal range. That is a good sign.
What did you do other than just give her the hydration?
We did the hydration with a particular type of nutraceutical or typical type of iron that actually was specific to help her own hemoglobin come back, and that's what happened.
And if she didn't come to you,
well,
she probably wouldn't have known that.
Not in that moment. She probably would have known it further down the road. The important thing is, let's make sure she's not losing blood somewhere. So what we urged her to do is go to the GI guy, go back to her rheumatoid guy. Let's just make sure. But I can tell you 4 weeks later it's holding. So it really probably was more like a dietary thing, or there was an interaction with some of these immune therapies that they keep pushing people to take.
And she took them.
Oh, yeah.
Okay.
Yeah.
Okay. So that's one case.
Yes.
How about the case of Tim?
Oh, Tim is a wonderful case because Tim has called the show several times. Tim had COVID and seriously had COVID. He was in the hospital. He never was intubated, thank God. We sent him to the hospital rather quickly. And we gave him many, many hydrations prior to this because the interesting thing was Tim was testing negative for a period of time for the COVID. And then all of a sudden it turned up positive and we knew we had to get him to the hospital. But he's out. He's doing well. But he's still having a problem with his lungs, which is one of the post-COVID things. So we are treating him with high doses of vitamin C. We're treating him with things like amino acids for the lungs. And also we're treating him with a regenerative medicine product, MSCs. And I've got to tell you, he's really improving. He told me, I think the day before yesterday, he's finding that he's able to walk further. He's not having as much huffing and puffing on his chest. These are the things, this is the kind of medicine we love to do because it affects the quality of life. I'm not curing his post-COVID. My doctors aren't curing his post-COVID. But what we are doing is we're holding down the post-COVID inflammation that allows him to have a better quality of life. The real thing in using this on patients are on my cancer supportive patients.
Okay, a couple of questions. Are you using regenerative medicine in this case, and do you use it in other cases?
Oh, yes.
Yes. Is it always a factor?
It can be, but I don't always use it in every case because it really is case dependent. What you want to do is you want to effectuate change. For example, for the MS patients, I'm using it, yes, but along with nutraceuticals in addition with that, particular for the particular problem.
Okay, let's take a little turn. You mentioned the cancer patients.
Oh, sure.
What is the
cancer support?
Similar, different? What is the situation?
Well, one of the things I want to tell everybody out there is I really want people to start looking up some of the data that I look up. For example, there's a ton of new data from 2012 up talking about cancer with promising natural products, mechanism of action on molecular targets. Now, that sounds like a big fancy thing. Honestly, what it's saying is there are some God's ingredients that can target the inflammation markers that cause the cancer to continue to wreak havoc with certain people. And we use that. We use that in our cancer supportive therapies. For example, if we looking at one particular type of cancer, we might use something like graviola, which is an extract from evergreen. a particular type. We might use something, a mushroom extract for breast cancer. So it depends on what we're trying to effectuate the change on. What we want to do is support the patient no matter which way they want to go in their cancer journey. Pam, everyone knows Pam, who calls in here several times. She didn't do any chemo or radiation. She had the surgery, got it out, and then followed a completely natural way of life after that, including hydration very steadily once a week in the office. So that's one way. But I also have patients who do chemotherapy and radiation. A gentleman yesterday, by the way, we're there every Saturday now through the winter. I had a nice patient. He had prostate cancer. He did the radiation. He said, Dr. Molly, I don't think the radiologist was shocked at how quickly I recovered from the radiation. And he said, in 5 weeks, I'm feeling like my old self. And I told him, well, I go to Dr. Molly's. He said, oh, I don't want to hear about that. And he's a sweet guy. And this guy commutes to New York every day.
Oh, my.
Every day. He didn't miss one day of work. While he was doing the radiation, what I did was I tempered his protocol so as not to what? To lessen the effects of the good effects of the radiation on him. In other words, I had to be careful what type of nutraceuticals I gave him, but I gave him enough to keep his stamina up. So that's a great case.
You have talked about a lot of nutraceuticals that you use.
Yes.
Can a patient come to you and can they supplement what they do outside with stuff from the health food store?
Sure they can, but what they have to do is realize that when we look at these studies that I'm referencing, they're talking about high levels, high dietary intake. I found that most people can't do that. They can't do it. They just can't do it.
And why is that?
Because their stomachs bother them. They can't take enough. Gosh only knows what's in the nutraceuticals. And as you know, we believe in certain brands. And you know what? It's all about what? If you don't take enough, you're never going to re-regulate the inflammatory and the pro-inflammatory signaling pathways and never get the end that you want.
So you almost can't.
You can't take enough.
What you're giving.
Not enough. It's good. Look, I don't want you to have to go steady with me. I get it. You know, after a certain period of time, you want to step down. I have people who come in once a month who've had cancer. They come in once a month. We give them a list of nutraceuticals to take at home. They follow that. There are certain brands that are better than others, as you know. They'll follow that. They do that. They come in once or twice a month for their reserve. But they also lead a very clean life, John. They're eating organic, they're eating vegetarian. I mean, all those things. But most of my patients can't do that. They're working people, they're entrepreneurial, they're high level executives. They got to get in and out, and they just can't do it.
Yeah. Well, that's understandable.
Right.
Because you can't duplicate what you're doing.
Absolutely.
And you should know that going in.
Right.
But some people say, oh, well, I can do it. And
that's okay. And I want to work with it.
Yeah.
That's the whole point. I'll work with you. Whatever your cancer journey takes you on, we will work with you. There's no judgment.
Okay, we're coming up on our final break of the morning, which means you still have time to call in with a question or a thought for Dr. Molly.
That's all right.
855-839-1210. 855-839-1210 is the number here in the studio. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly and I will return after these words. We are back on Health Watch. Operators standing by right now at Innovative Medical Associates, 856-489-0505. That's 856-489-0505. Call up and make sure that you make that appointment for the initial consultation. You'll learn a lot. Dr. Molly and her staff will be happy to meet with you. It's 856-489-0505. And, of course, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Before we get back into the show, do want to remind you also that we are on this afternoon. It's our Health Watch replay from 4 until 5. right here on Talk Radio 1210 WPHT. So if you miss any of it, you can catch it this afternoon, or if you want to hear it again, you can do that too. 4 to 5 this afternoon here on Talk Radio 1210 WPHT. It is the live version of Health Watch every Sunday, 8 till 9. Let's go to the phones. John is in Bucks County. John, you're on with Dr. Molly on Health Watch.
Good morning, John.
Hi, good morning. I've spoken to you guys before, and I love listening to you when I can.
Great.
I'm calling about my mom, and I got to get over to you guys, and I keep saying I'm just dragging my feet. She has vascular dementia. She's 84.
God bless
physically
her.
strong. She's been great all throughout the COVID pandemic. She had it, bounced back wonderfully. I did give her ivermectin, so I know we got to keep that on the down low.
Yeah. Hey, listen, John, I love you already, and you're a good son, obviously. Yeah.
So, and she hasn't gotten the shot, so I'm not planning on doing that.
Good.
Not that I'm calling about that.
What?
But my thing is, I've tried so many things. Like I have her on a lot of nutraceuticals.
Good.
I have her on off-label meds for
Good.
the dementia that I've researched. I am a pharmacist. I think I told you that before.
Yeah. Good.
And, nothing seems, and I'm not looking for the cure because I don't think there is one.
Right. Right.
But I really struggle with it's progressed. And, I didn't know with your, I always hear you talk about hydration therapies, and I didn't know if you have some type of treatment protocol for her. So I would come in.
Yeah, I would love, John.
I'm grasping for straws here.
I'll tell you what, John, I would really love to talk to you in the office because there are some things I particularly I have several pharmacist patients, believe it or not, mostly bringing their wives, their mothers, or their dads are in to see us too. So I respect what you do for a living because it's very difficult today. And the pharmacists, by the way, are my best friends because they help me know what kind of things we can actually make viscous enough to give in the IV. Nonetheless, I think one of the things we ought to look at for your mother is the phosphatidylcholine. And I think, we particularly use a German recipe that was done a while ago, but it is one for removal of plaquettes and increasing some of the blood flow. Also, I want to talk to you about a regenerative product, using the MSCs. And I want to show you a couple of the patients who we've used this on. I've done that for MS and certain other neurodegenerative. And I'm actually this week using it on another patient who has a mild form of the dementia. She's already had one treatment of using the amino acids, etc., and she's had some improvement. This week she's doing another. The thing about this, John, is it doesn't work for one treatment. Do you know what I mean, John? We got to get her in for a series, okay?
Yeah.
Please come in. Okay. Please come in. Thank you.
John, I'm going to go on the website and make an appointment, or is that how I would do it?
Yeah.
Or call. It's simpler to call.
And you know what, John? Say you're John, the pharmacist who spoke to me, so I make sure my lovely Linda makes sure you get in that book, okay? I want to talk to you.
Okay.
God bless you.
You can call right now.
So much.
Thank you.
I love you guys.
Thank you.
Thank you.
Thank you, John.
Thanks for the call, John.
Great call.
Yeah,
okay.
he should call right now.
Right. Yeah, Franny will take it.
Let's talk to Lana in the Northeast. Lana, good morning. You're on Health Watch with Dr. Molly.
This must be my lovely Lana Lee.
It's Lana Lee.
Okay.
Good morning, Dr. Molly and John.
Hey,
Good
guys.
morning.
Good morning.
Dr. Molly, usually on Sundays I sit here with my story, and I thought, you know what? I got to tell my story.
Okay.
Before I met you, Dr. Molly, or heard you on the radio, I had been to many homeopathic doctors, feeling like a clock that wasn't wound up, applied kinesiologists, acupuncture, just
Love it.
I never gave up. And thanks be to God, I didn't give up until I found you and what you do.
Thank you.
And Dr. Molly, honestly, I had 3 grandkids yesterday, a grand dog, and I kept up. And it's only because of what you have given me, both physically, medically, emotionally, because if I feel better physically, I can go back out there and live my life.
Amen.
And I can only thank the work that you do.
And the good Lord.
My last treatment with you, because I certainly crawled in there, darn near.
I remember.
And my last treatment with you, you said, "Hey, Lana, you're South Philly. Hey, Lana Lee, would you want to come in and help out a little bit sometimes?" I'm so blessed to be there with our family, our Dr. Molly family.
Let's say the words. You're a registered nurse. Let's tell them the truth. You're a registered nurse
I'm a registered nurse and a happy camper since I met you.
God bless you.
And the work that you do, Dr. Molly. Listen, I remember coming home from the kinesiologist with 30 pill bottles.
Nah.
Can't do it. No. But I
can't do
it. You sit there and you take good care of all of us.
Thank you,
including staff.
I try.
And we're able to run even faster because of
God
what
bless
you do.
you. And I appreciate all of you. I really do. And Lana, I really appreciate what you're doing for us.
Thanks for the call.
At the facility.
Thanks
God
for the
bless.
call, Lana.
God bless my nurses.
And we have Gary in LBI. Gary, good morning.
Another wonderful patient of mine. Hi, Gary.
Hi, how are you, Dr. Molly?
Good,
I want to leave a comment, and I want to...
Thank you.
First, I want to say, but for the grace of God and Dr. Molly's clinic with all those doctors and wonderful nurse girls in there, we've kept our inflammation low, and our immune system high, and through all these years coming into you and how great we feel and young we feel, and I just wanted to thank you. It's been wonderful all these times coming in there and always feeling so good when we leave and when we get in.
Thank you.
My question is, a lot of my friends in Florida now too are talking about how long COVID is really affecting them more and more with headaches, and they feel lousy, and now I've got one up here close to me. It's been going on for weeks too, and it's getting serious and more serious. And I just thought I'd throw that out about long COVID, how this seems to be popping up more and more.
You're right. You're right,
Gary.
Very
much.
Thank you, Gary.
Thanks for the call, Gary.
And it is true. The long COVID is really, really tough, John. And it's a thing that people should realize. We can help you through that by holding down the inflammation, but it's very specific protocol. God bless.
This goes back to inflammation, which you started the show with.
Absolutely. And this is exactly. And I might add, listen, we want you to feel good. That's our whole thing. We want you to feel good. We want you to have a quality of life well into your 90s, well into that. This is what it's all about. I believe the good Lord helps us, and He's the big physician, and He's put all these things on earth for us to use. And I think if used properly, people will feel better.
And with that, we are putting the wraps on another edition of Health Watch. Don't forget, operators are standing by right now, 856-489-0505, 856-489-0505. The website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And don't forget, if you missed us at all this morning, you can hear the replay this afternoon from 4 until 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical, the lovely Linda, and our nursing staff, Barbara, Catherine, and Lana, delightful Dee, fabulous Fran, Joanne, and caring Kathy, all of us, thanks for listening. And we will do it all over again next Sunday. Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.